In this section, we're going to talk about the primary assessment. The primary assessment is the first thing we want to do when we come up on a patient, treat their medical emergencies. The primary assessment is all about identifying life threats and treating those life threats immediately. Life threats are all the things that could kill a patient within the first 5 minutes. So let's start talking about the steps in the primary assessment. You can follow along in my book starting on page 1. So let's turn to page 1 right now. The first thing that we want to do is we want to make sure that the scene is safe. Now, we walk up to the scene and there's a reason why this patient is on the ground. And it could very well be something in the environment, something that is still there that put that patient on the ground. And the last thing that we want to do is we do not want to put our life, our safety in jeopardy. So take a really good look at that scene and see if there is anything there that is unsafe. If you can make the scene safe, then please do so. But if you can't make the scene safe, then you need to stay out. You need to try to contact the authorities to get professional help there that can make that scene safe. After you make sure that the scene is safe, you want to form a general impression. You want to start asking questions. Maybe you walk into a room and you see a ladder laying on the ground and paint splattered everywhere and a patient laying next to the ladder, which would give you an idea. Maybe that patient was on the ladder and they fell off. So form a general impression. While you're forming a general impression, look for any life-threatening bleeding. And we're going to talk about life-threatening bleeding when we talk about soft tissue injuries later in this course. But we're looking for any type of life-threatening bleeding, which is a big pool of blood around the patient. Or maybe you see blood actually spurting out of the patient. Or maybe the patient is completely covered in blood. If we see life-threatening bleeding, we're going to want to take care of that right now and stop that bleeding. We're going to talk about how to treat bleeding injuries, how to stop bleeding, how to stop traumatic bleeding later on in the course.